Welcome back everybody, Remi Sovran here from RemiSovran.com. With today's new video, I'm going to be going on a little bit of a rant regarding the term degenerative disc disease, and I'm going to explain to you guys why this term can be problematic and why it can negatively impact people who are specifically diagnosed with degenerative disc disease, and why this term can be really confusing. So what we're going to do is we're going to just jump over to the computer real quick, and I'm going to go through just kind of the definition regarding a couple websites and what they kind of label and describe it as, and then I'll kind of talk to you about how this term, when people are labeled with it, can actually be problematic and actually have a negative effect on people with regards to developing additional problems. Okay guys, so what I brought up here is just two websites that describe degenerative disc disease. The first website here is spinehealth.com. And so I'll just jump right into their definition, and then I'll jump into the other website's definition just to kind of touch on it. So simply put, degenerative disc disease describes the symptoms of pain and possibly radiating weakness or numbness stemming from a degenerated disc in the spine. While the definition sounds simple, many patients diagnosed with degenerative disc disease are left wondering what this diagnosis means for them. And so if we scroll down a little bit further, degenerative disc disease is a misnomer. A diagnosis of degenerative disc disease is alarming to many patients because it sounds like a progressive, threatening disease. However, it is not really a disease. This is not strictly degenerative. For most people, the term degenerative understandably implies that the symptoms will get worse with age. However, the term does not apply to the symptoms, but rather describes the process of the disc degenerating over time. While it is true that disc degeneration is likely to progress over time, the pain from degenerative disc disease usually does not get worse, and in fact, usually gets better given enough time. Degenerative cascade theory explains how this process works. Now, if we flip over to Wikipedia, degenerative disc disease describes a natural breakdown of an invertebral disc of the spine. Despite its name, degenerative disc disease is not considered a disease, nor is it progressively degenerative. All right, so now I'm going to flip over to the camera, and I will explain what this kind of implies. Now, as you can see, guys, I just went through those two websites, Wikipedia and spinehealth.com, describing degenerative disc disease. And both of them, what they state is that degenerative disc disease is not a disease and it's not progressive in nature. However, the term degenerative disc disease implies that. So when we think of degenerative disc disease, so first of all, when we think of degenerative, we think of progressive damages over time that may be irreversible and won't get better with age. And at the same time, when we think of degenerative disc disease, we're labeling someone as having a disease when they actually don't have a disease, which is just clearly stated with regards to both those definitions and terms. And so here's the big problem with the medical community and when they use this term is now, when we diagnose someone with degenerative disc disease, we're diagnosing them, or we're implying that they have a disease and that it's not going to get better over time. And so what this does to people is when they are diagnosed with degenerative disc disease or have that diagnosis, is people start to think to themselves that they, number one, have a disease. And so when you think of people with diseases, you think of illness, sickness, and you don't attribute them to kind of good feelings, or you kind of think of them as just not attributed to maybe a higher or good status in a sense. They're in kind of bad shape. And at the same time, when we think of the term degenerative, people, when they hear that term, they think that they're not going to get better, and it's just something that occurs with age and they're not going to get better. Now, we know spinal discs heal. They can heal on their own. It takes a lot of time. But the important point here is when we start diagnosing people with this term, and using this term to diagnose people with a damaged disc per se, people start to, they may get depressed, or they may get feelings of depression, and other problems might start accumulating or develop as a result of an individual knowing they have a disease now, especially a degenerative one that may not get better. Yet that's not true, and actually their disc or whatever damage to the disc that has happened can actually heal, can actually get better. And if you just look to differences with regards to spinal discs between younger individuals and elderly individuals, there's change in the biomechanical properties and biochemical properties, where an elderly individual is likely to maybe have less pain as opposed to a younger individual with regards to maybe some sort of spinal disc injury. And so there you can kind of toss out the term degenerative because it makes no sense. And secondly, we're diagnosing people as having a disease when they don't have a disease. It's just some sort of damage that they have. And when we start implying that disease, they start thinking the worst, and that's how things like depression or other maybe psychological problems may develop, because people may not think they're going to get better, and this is going to be with them the whole life when that's not true. And so therefore, with regards to the medical community using this term, it's a big flaw and a big issue, and it's doing a disservice to many people, especially with people that aren't specifically familiar with the term and what it's kind of referring to in the medical community, because just from a general point of view, people won't have that understanding, and they're obviously going to be led to believe they have a disease because is a degenerative disc disease. That's the term they're being labeled with. And so we're labeling people the wrong way here. And so that's just the point I wanted to make with regards to this video and this little rant, because I think it's a big problem. There's the term degenerative disc disease in general, and it's not an appropriate term to use to diagnose people with kind of damage to a disc. Rather, we should be labeling, or rather not so much labeling, but describing people as maybe having some sort of maybe contained herniation, nuclear herniation, or maybe like some sort of annular tear, which would be a better way to think of things. Now, if you're someone that was diagnosed with degenerative disc disease and you were led to believe that you had a long-lasting disease that was never going to get better or was just going to get worse, progressively worse over time, I'd love to hear your story, and especially if you're someone that's kind of made a comeback, overcome your pain, or if you didn't have any pain with regarding that diagnosis at all, and you've kind of gone better today, and you got yourself out of that situation. I'd just kind of love to hear your story, guys. And if you're someone that kind of went through that type of diagnosis, or if you're just someone that wasn't even familiar with kind of the term specifically, just kind of love to hear about that. Just because I think it'd be really interesting, as a lot of people tend to be diagnosed with this, and it tends to lead to a lot of other problems, whether that's depression or other kind of psychological problems as well. Okay guys, so that's it for today's video. If you guys enjoyed this, be sure to give it a thumbs up. And also, if it's your first time watching one of my videos, be sure to subscribe. I'm always posting different health and fitness tips, specifically regarding lower back injuries. And if there's anything you want to specifically see, guys, leave a comment below. All right, I wish you guys all the best and a successful and productive day, and take care.